in different hotspots, people may have to have more restrictive measures, and based on what I heard, my colleagues are fully prepared to do that if necessary. But you can avoid it. So, my message today is the time is now. We're at a bit of a crossroads. If you manage to reduce those contacts and make some choices in terms of not going to big gatherings and some of these social events, you can manage this without a lockdown.
Welcome back to Power in Politics. Canada's Chief Public Health Officer, Dr. Theresa Tam, there delivering a warning to Canadians. If Canadians don't follow public health guidelines, this country could see a second wave of COVID-19 that's more severe than the first. The Public Health Agency of Canada updated its federal modeling projections today. If the current rate of contact between people continues, we could see more than 3,000 cases a day across Canada by mid-November, according to the data. Check out the sharp rise of that gray line. If the rate of contact between people increases, that would lead to a sharper increase in the number of new daily cases. That's the orange line. But if the rate of contact decreases, the epidemic is projected to come under control in most regions. That's the smaller blue line there. Hope you can see it all. To dig into the latest modeling and more, I'm joined by Dr. Isaac Bogosh. He's an infectious disease physician and scientist based out of the Toronto General Hospital. He's in that city. And Dr. Zane Chagla, he's the Medical Director of Infection Control at St. Joseph's Healthcare in Hamilton. He's in Mississauga. Hi to both of you. Thank you very much for making time.
No, thanks for having me.
Dr. Chagla, I'm going to start with you. The numbers that we were provided with today, I mean, just looking at the raw data, we're looking at more than 1,000 cases on average now each day across the country. The reproductive rate sitting at 1.4. From your perspective, when Dr. Tam says we're at a crossroads, what does that tangibly mean?
I mean, it means that with the reproductive rate as it is, if we're going to let things go unchecked, if we let things grow as they are, we're going to see more and more cases that are going to spread to more and more cases, and we're going to see the growth rate rise in our communities. The issue is we kind of have to act sooner rather than later. In Ontario, there are some new restrictions. In BC and Quebec, there are some restrictions. But those restrictions don't really influence the models and the numbers that we get for another 5 to 10 days, as whatever's seeded in the community is ongoing. So I think this is where we are. This is a crossroads to say, okay, do we need to implement more? And can we hang on to see whether or not it's actually working?
Yeah, Dr. Bogosh, I was wondering as I was listening to that update today, is it a case of further restrictions have to be implemented or people have to listen? And I ask only because the message has been fairly, kind of the same for a number of weeks now, right? They've been telling us, and especially younger Canadians, we know more than 60% of these cases are in the demographic of 20 to 39 years old. They've been saying to them in venues they go to, don't do this, don't get together in your backyard, don't have a party. But it seems to, still be persisting. So from your perspective, does that necessitate further restrictions, or is there still hope that the message gets through?
I think the message can get through, but it's not just the message, it's who's delivering the message and how is the message being delivered. Currently, the message is being delivered by senior political and public health leaders. And while the message is spot on, it might not be landing on the right ears in the right language at the right in a cultural or language or age-appropriate manner. This is really the time to engage communication specialists. They're out there. They're fantastic at what they do. They're the people that convince us to buy the cars that we buy or eat the food that we eat or travel to where we travel to. They're really in the business of driving behavioral change, and it is certainly time to engage these professionals to help drive behavioral change and get the right message to the various cohorts that are disproportionately impacted by the virus.
This show, Dr. Chagla, is politically focused, so I'm always very interested in what people like yourself, experts like yourself and Dr. Bogosh have to say about what governments should be doing. If you had a piece of advice for provincial governments and the federal government right now, would it be to implement further restrictions, to go further than they might feel is okay for businesses, which we all, of course, have a lot of empathy for? Or what would your advice be?
I mean, this is unprecedented. I think there are multiple paths in multiple nations and multiple places that have taken different paths at fuller restrictions versus more messaging. I think, realistically, as the rates grow in our community, we're going to see them percolate into businesses, and we have to be prepared that eventually there is going to have to be some slowdowns to some of the high-risk businesses. The advice I would say is just be transparent about it. Be transparent about the metrics to close things down, and then be transparent about the metrics to open things up. The worst thing you can do is put people out and not necessarily have a goal to actually open them up again. I think, if we do go down the path of restrictions, it has to be right on paper in terms of everyone understanding why and how.
Dr. Bogosh, speaking of kind of further restrictions or new orders here in Ottawa today, there was a pretty big headline that I know was circulating our newsroom and beyond. A lot of sort of initial surprise, and I wanted to get your take on it. The medical health officer here has issued a new public health order mandating a 14-day self-isolation period for anyone that exhibits any signs or symptoms of COVID-19, has reasonable grounds to believe they have it, or has been in contact with anyone who has tested positive, or you're going to face a very hefty fine, $5,000. Initially, when I saw that, I was confused. Like, if you have any sign, any symptom, I mean, if you have a kid, that there's, sniffles, it can happen any day during the winter. I'm just wondering what your reaction to that is, and is that what we should be expecting from other local governments?
I think on the one hand, it's really important to message clearly who should be staying at home and isolating for 14 days. And it should be exquisitely clear to ensure that people know what the right thing to do is. So that's point one. The second point is, okay, what do you do with people that aren't adhering to that? And then we have to think about, well, is a $5,000 fine the right approach? Typically in public health, fining has not been the most effective approach. Typically we've even seen it with COVID-19, but certainly with other public health initiatives, fining usually disproportionately impacts more marginalized groups or groups who are already disproportionately impacted by the virus in the case of COVID-19. So that might not be an ideal strategy, although I am very curious to see how it plays out.
Dr. Chegla, what do you think, especially on the point around symptoms? Like, if you exhibit anything, you have to stay home unless you can produce a negative test. And the symptoms, I mean, when you go on the Ottawa Public Health website, the symptoms vary. I mean, it's a long list. It's anything from a sore throat to diarrhea. And what is your initial reaction to that?
Yeah, I mean, I think the Ontario screening tool really puts it appropriately in the sense that it's not only symptoms, but it's symptoms that are not explained by another reason. The spirit of these types of public health interventions aren't necessarily to deal with the unreasonable person. I think the person that has diarrhea from a single day of eating some sketchy takeout is going to be very different than someone that's having sniffles, cough, cold, right, fevers for 4 days and decides to go to work. And I think really this act is meant for that latter person, is the person that's blatantly symptomatic, that is continuing to spread in the community, to give them some disincentive to not necessarily do that and go get tested and making it part of their civic duty.
Dr. Bogosh, before I let you go, I wanted to ask you about testing. There's this huge political conversation right now around rapid testing, how fast it should be approved, how quickly it should be in use. And the Conservatives today, actually, their Ontario caucus said that they used serological tests that had not yet been approved by Health Canada, but a company had come to present to them, and they utilized them. They were able to get results very fast. I know that serological tests are not the same as diagnostic ones. They, in fact, are supposed to measure antibodies. We don't even know if antibodies necessarily mean that you're totally immune from the virus. What do you think about people using tests that have yet to get Health Canada approval?
I think it's a bad idea. I think we have to let Health Canada do its job. Of course, Health Canada needs to do its job well and expedite the evaluation of tests that might be useful for Canadians. If that process isn't done well, we will be left with a scenario that we saw in the United States, where they basically let all these serologic tests onto the market. And at the end of the day, the CDC had to come out and say, stop, these are useless. We don't know how to interpret the results. So there's clearly a balance between getting the appropriate tests into Canada and using them in an appropriate manner, but also doing that in an expedient manner as well. So I would wait for Health Canada. Okay, I'm going to leave it there. Thank you very much to both of you for sharing some of your time this evening with us. Thanks to Dr. Zane Chagla, my apologies, and Dr. Isaac Bogosh. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.